Hi everyone, this is Dr. Krishnan.K. We have another clinical anatomy query in hand, and let's see how it looks and how the presentation of this particular condition is, and we will see the causes behind it. So today's topic of discussion will be the carpal tunnel syndrome, which is commonly known as CTS. And the patient will be coming to you with this particular typical presentation where there will be tingling and numbness in the fingers or hand, and usually the thumb and the index finger will be affected, or the middle finger and the ring finger will be affected, and it will be presented as a weakness in their hand, and there will be a difficulty in gripping the objects. So that will be the complaint which is given by this particular patient, saying that I have difficulty in gripping the objects in hand, I can't hold a cup properly, and similarly there will be associated numbness, tingling, or sometimes even pain. So these are the typical presentations. So let's turn the pro anatomy mode on to identify the causes behind it. So the first and foremost thing to remember is it is caused by the compression of the median nerve. So let's analyze the causes, dividing them into three types. We have the workplace factors, which precipitate the cause or which precipitates to form the CTS, and the anatomical factors and the inflammatory underlying conditions causing the CTS. So the first one is workplace factors, where wherever there is repeated strain occurring to the wrist, there are chances of a median nerve compression. So here one example is the heavy labor workers, where they are using the equipments which are vibrating tools, that will put on stress on the wrist joint very often, and that too repeated strain over this region causes the inflammatory response, and thus by compressing the median nerve. And similarly, like the people who are doing computer jobs, and they have repeated strain occurring to their wrist due to typing, using the mouse, etc. And that can also be an precipitating factor which causes the inflammation of the wrist joint, and thus by causing the median nerve compression and causing CTS. And we have anatomical factors, where there is like congenitally, or like some people will be having a narrow carpal tunnel when compared to the normal individuals, and that in turn can also be a case where CTS can happen. And the third one is the inflammatory conditions. Usually the inflammatory conditions like rheumatoid arthritis, which is the commonest one, and synovitis, that is nothing but the inflammation of the synovial sheath of the tendons passing through the carpal tunnel, is another reason for CTS. So let's have a closer look into the anatomy of the carpal tunnel here. So here we have an image representing the passage of median nerve passing below the flexor retinaculum and supplying to the fingers of the hand. So here you can see it is passing below the flexor retinaculum, and along with that there will be many other structures passing through the same tunnel, and any inflammation to any of the structures can in turn cause a compression of the median nerve, and the CTS will develop. So here we have the cross-sectional image of the carpal tunnel, where you can clearly see the tendons passing through it, which is represented by the navy blue color, and you can see a pink color covering, that is nothing but the synovial sheath covering these tendons, which will prevent the adhesion between them. And if in case this flexor retinaculum is getting inflamed, or if the synovial sheaths are getting inflamed, the median nerve which is passing through here will get compressed by the related structures, and that in turn causes the presentation of CTS, where there will be weakness, tingling sensation, or numbness in the hand, and that in turn is considered as the carpal tunnel syndrome. So you should have a clear idea about the carpal tunnel, how it is formed by the flexor retinaculum, and what are the structures passing beneath it in order to identify the carpal tunnel syndrome. So that is the important factors to remember and the important structures to be remembered while understanding the carpal tunnel syndrome. And if you have any further clinical anatomy queries, please comment them below in the comment box, and that will be answered soon through the Pro Anatomy help desk. Thank you.